As a GP, physical activity in daily life is really, really crucial, and I think the chief medical officers have said it's the best buy in medicine. So in the context of health, it's one of the most important things at population level that we can get people to do. It's really important to understand the triggers around inactivity, and sometimes that conversation starts away from the activity itself. So I've been hearing about your knit and natter sessions, which may lead into a walk and talk, and this learning is really key to understanding the way that people are and how best Essex can operate to get people more active. The primary care networks really give a great opportunity for GPs, nurses, physios, in fact the whole healthcare team, to work more closely with physical activity providers, the local council, the voluntary sector, when it comes to physical activity. I think what's crucial is that there are some GPs that step forward and become clinical champions for this, because that's when you get those real connections between the healthcare sector and the wider local sector. And when it comes to physical activity, it affects everybody. It affects the individuals, it affects the healthcare system, it affects the local community, it affects the whole of Essex. So it's really crucial, I think, that we have GPs as leaders sat at that table having the GP voice, because without that we're really missing a trick. I think in the last maybe 10 years there's this real growing trend towards the thought and the belief and the idea that people should be taking more responsibility for their own health, and that's not going to stop, and that's right. But whilst that is the case, we must also recognise that for some people, taking care of your own health is easier than it is for others, and that's dependent on your social circumstances, your psychological well-being, whether you have a job, whether you have any other health conditions, if you have children, if you're a single parent. So although I think that's correct, we need to recognise that for some people it's really difficult actually to take responsibility for your own health. And the local delivery pilot, that's where that comes in, and it's really important that the public sector, the private sector, the community centre all work together to help support those who find it the most difficult to be able to access that infrastructure that exists in Essex to enable people to be healthier.